Welcome to a new semester of EMT classes. One of the things I've been accused of is throwing out some acronyms and terms before explaining what they mean, so I wanted to create this video to maybe help you understand some of the things I'm saying in class. We use a lot of acronyms in EMS. In fact, EMS is one, and that stands for Emergency Medical Services. At the beginning of it, we start with some basics in EMS, and documentation is one of the things that we do. The SOAP method is a method that we use for documenting all of our patient contacts. So subjective information is information the patient tells you. Objective information is information that you see when you assess them. Assessment is combining those two things to determine what is wrong with them. And then P is the plan of treatment that you have for the patient. BSI is body substance isolation. We want to treat every patient's body substances, such as blood, as something that's infectious. So we want to use equipment to protect us from touching that or becoming contaminated with their blood or body substances, so that way we won't get whatever disease or infection they may have. When we're checking to see how awake someone is, we use the AVPU method. And A stands for whether they're alert, so do they look at you when you come in. V is verbal, so do you have to call their name or shout something to see if you'll get a response? If they don't respond to that, if we use an approved painful method of stimulus, do they respond to that? And if not, then we then call them unresponsive, and that is AVPU. The sample history, SAMPLE, is something we obtain on every patient. We want to know what their complaints are, so those are their signs and symptoms. Are they allergic to anything? Are they taking any medications? Do they have any P, past medical history? What is their last oral intake? That's the L. And then the E are the events that are leading up to the incident. So what was happening when they became sick or they got hurt? Going along with that is OPQRST, and this works best for someone that's in pain, but we can adopt it a little bit or modify it a little bit for other patients. O is onset, so what were they doing when it started? P is provocation or palliation, so does anything make it better or worse? Q is quality, so have them describe the pain. Is it sharp or dull or achy? R is radiation, does it go anywhere else? And the classic is chest pain that radiates like to the neck or to the shoulder or to the arm. Severity, ask them on a scale of 1 to 10 how bad the pain is. And then T is time. Is the pain constant or does it come and go, and when did it start? AEIOU-TIPS is one that we'll use later in the semester when we talk about people with altered mental status, and it's an acronym we use to try to remember the causes of why someone may be altered. And could it be that they have some alcohol intoxication? Is it possible that they had a seizure in their post-ictal? That would be epilepsy. I is for insulin, so could they have a problem with their blood sugar, too low or too high? We need to check that. O is overdose. Could they have possibly overdosed on something? Some people will also say oxygen. And do we have a hypoxic patient that we need to check? U is uremia, so could they have something wrong with their kidneys and they're building up toxins in their blood? The TIPS is T for trauma. Could they have a head injury? I could be infection like meningitis or sepsis. P is psychosis. Could they have something psychologically that is causing an altered mental status? And then S is stroke. Could they have had a stroke and that's what's causing their altered mental status? Switching gears to trauma patients, when we are trying to assess for injuries, we use this DCAP-BLS-TIC, and some people will say DCAP-BTLS. And D is deformity, so do we see a deformity in an arm or a leg that makes we think we have a broken bone? Do we have some bruising or contusion? Is there an abrasion or scrape? Is there a puncture or penetration to them? The BLS is for bruising, lacerations, so is there a cut to them? And then swelling. Is there an area that's just swollen like an ankle? TIC is tenderness. Does it hurt when you touch them? Does it feel unstable or instable? And then crepitus. I hope this helps. If you have any questions, please leave them in the comments below or ask me in class if you're one of my students. If you like my videos, I hope you subscribe to my channel and you click the notification bell. Thank you.